think that what we're really focusing on is the 800,000 people in the state of Louisiana that are underinsured or underinsured that are entering the insurance marketplace for the very first time.
That's huge.
That is
800,000. These are people who haven't had any interaction with insurance, right?
That is correct. And so what we're doing is really educating them on that process. Everything from what is the difference between co-insurance and co-payments, what are deductibles, what are premiums, educating them on that process. What is the insurance process? And then two, educating them on what are the options available in their community.
And you do that as a, you're not paid. In other words, people who need insurance or who want information about insurance, that it costs them nothing to talk to you and the people in the agency that employs you, correct?
That is correct. Part of the Affordable Health Care Act is there was a pot of money that was set aside specifically to help navigators, to train them and to help them provide that education throughout the country. And that's what we're doing. I mean, we are paid for by the federal government to provide unbiased information. So we show people all of the qualified health plans that are out there. We help them navigate that process, and
hence the term navigators.
Hence the term navigators, to navigate that process and then help them to figure out what is the best for them. We do not pick any particular provider or any particular plan. We just want to make sure that you have all the information so you can make the decisions that are right for you or your family.
And it's so interesting because I was talking to someone not very long ago, and he said to me, I just wish they would tell me which plan to choose. It just seems like so much information. I just need somebody to tell me which plan to choose, but that's not what they're there to do. And what I've heard is that really you can get an apple-to-apple comparison of the plans.
And that's the beauty about this, the way that it is set up, is we can really look at all the different qualified health plans, QHPs, across the board, and look at which one is the right for you and your family. For example, there are those that might live in the southwest corner of the state or the northeast corner of the state. You know, Lake Charles area is very close to Houston. Many people from that area like to be able to have options where they can cross Texas borders. Same thing with communities like Tallulah, Louisiana, and the northeast corner. They like to be able to cross over into Jackson. So maybe for them, a plan that gives you the ability to cross state lines is more beneficial than other particular plans. So we just really want to try and understand what the best for you, what are your needs, and let's help you by showing you what plans are out there available to meet those needs.
So it costs nothing to get help from you and other navigators that work with your agency. What's the best way for people to talk to you or people that work with you?
Well, I think that the first thing that you can do is you could visit our website at louisianahealthcarenav.com. I think there are many different tools that people will be able to access. One of them would be to request a presentation. We have 13 advisory groups throughout the state that we work together to find those people who have a stake in making sure the constituency they represent, whether it's faith-based organizations, community-based organizations, civic, any organizations that have a gathering of people that would like one of our navigators to come and to really provide a community presentation on basically Affordable Health Care Act 101. And then from there, what we're able to do is we're able to make referrals. One of the things the navigators do is they work with all of the different entities in the state that are able to provide assistance. So it's not just the navigators, but the certified application counselors, the federal qualified health centers, the hospitals. Many of those people also are out there to be able to provide assistance. They just don't have that outreach arm.
Follow-up question. Suppose you're an individual, maybe you live out in the country, you're not associated with a big church or civic group. Can you get help over the phone or via that website that you named? What's the name again?
LAHealthcareNav.com. And the beauty about us is that we are an outreach entity.
Right.
Our goal is to go out into the rural communities and provide that education in rural communities, not to expect people to be able to come to the metropolitan areas.
And we're going to put the links on our website.
That is correct.
So you know, for our show website.
And for those that do not have access to the internet or to the website, we also have numbers available that
we'll put that on our website as well.
That is correct.
We mentioned hundreds of thousands of people out there who do not have health insurance. They're watching today, so let's talk to them and help give them some real practical information. Jim, you know, we were talking earlier, and you said that these are the people who you are looking to hear from and to work with. So, getting started, where do you begin? You know, we hear so much about the glitches. There are glitches there. Although, you know, we've been told that those glitches will be fixed by the end of this month. So how do you get started with this, even with all of those glitches that are going on?
That's a good question, and we know with 800,000 people who have gone without health insurance, there's a large percentage of them that require a lot of education and background on just what health insurance is all about. And with that, we're working in partnership with the Navigators, with independent brokers. We're doing everything we can through social media, through our website, we have an 1-800 phone number that people can call and just ask questions and hopefully get questions answered. And we're trying to do everything we can just to provide the basics about what health insurance is all about and why it's important, and then provide them information if they're interested in our products that we have to offer.
And I know that you have some scenarios that you're going to share with us.
I do.
Yeah, could you give us one, because right before we go to break, because we want to give people just an idea of what it might cost them.
Okay.
This is relative to your insurance company, correct?
The scenarios that I'm going to give is, Kaiser Health does a wonderful job of providing a subsidy calculator or a cost estimator on their website. We also include it on our website as well, so that anybody interested in getting a ballpark of what their monthly premiums might be with subsidies and tax credits that might be that they might be eligible for, they can go to that calculator and get a feel. And you guys probably provide the same calculator on your site as well. It's a wonderful tool. And this morning before I came on the show, I just ran a few scenarios just so that we could have an idea of what potentially a premium might be. And here's the first one, and this is for an individual living in Louisiana with a zip code similar to this area, because there are a few variables that you need to enter in the system, with an annual income of about $25,000, age 26, non-smoker, and no children, living on their own. Their amount that their health insurance premium for the year would be about $2,800. However,
Or female, I didn't hear.
that would be, it doesn't matter. Age,
or female, doesn't matter.
Male,
Doesn't
female,
gender.
doesn't matter
Okay.
anymore.
Okay.
That's part of the new health care
big.
law.
Okay.
Doesn't matter.
But for example, their health insurance premium for the year would be about $2,800. However, this person would be eligible for subsidy or tax credit that would reduce that by $1,105 a year. So now they're looking at an annual amount of $1,729, and their monthly premium would be $144 per month. And this is for a silver level plan.
Oh,